Welcome back from the break. We are continuing with this session where we are looking on what we call the leads, because we said that the ECG machine uses approximately around 12 leads. Now, we need to first understand what is a lead, because it's something which is super very important. Now, a lead is going to be the different directions of the view of the heart's electrical activities. Okay, the different views of the heart's electrical activities. Now, I want to first pretend for a minute and say, for example, a lead to be like a camera. Okay, and we are going to be having 12 cameras that are going to be looking at the heart from different angles. Okay, so now these kind of the cameras are going to be our leads. They are going to be looking at the heart from 12 different angles, and all these cameras will be recording an image which can be seen on what we call on the ECG paper. Okay, let's pretend for a minute that this is going to be our heart, but now we're going to be putting cameras from different angles. Now, when you come over here, we have three categories of the leads. What are these three categories of the leads? We have those leads which we call the chest leads. We have what we call the chest. We have what we call the chest leads. When we talk about the chest leads, these are the leads which are going to be looking at the heart in a horizontal plane, okay? In that kind of the transverse horizontal plane. They are going to be looking at the heart, from example, from the right ventricular myocardium. They are looking at the heart also direct from what we call the interventricular septum. They also be looking on the anterior portion of what we call the left ventricle, and even also they'll be looking at it on the lateral sides of what we call of the left ventricle. Okay, and these leads are what we call the chest leads. These leads are the one which are going to be illustrated as you are seeing here. So now there are going to be 6 of them. Okay, the first one is going to be this one which we are calling the V1, which is going to be put on the right side of what we call the sternum, and then this one is going to be our V2, which is put on the left side of what we call the sternum. This one here is going to be what we call the V3, and then this one here is going to be our V4. This one here is going to be our V5, and then this one here is going to be our V6. Okay, so now these kind of the leads are going to be looking at the heart in a horizontal kind of the plane. Okay, so now you're going to be having a V1, you're going to be having V2, you're going to be having V3, you're going to be having V4, you're going to be having V5, you're going to be having V6. Okay, so far we have seen that we have already the 6 chest leads, which we call the precordial leads. Okay, then we also have some other leads that was invented by one of the great scientists, named as the father of electrocardiography, called William Einthoven. William Einthoven came up with a specific kind of a beautiful kind of the triangle that is going to be giving us more of what we call over the leads. You see this kind of this triangle. This man called William Einthoven, he placed electrodes on what we call the right arm, and then also on what we call the left arm, and even also on the left leg. And then he came up with this kind of this triangle. And this triangle is helping us to give us a view of different kind of the leads. So now this kind of the triangle is also going to be helping us in developing more of the leads that are also going to be looking at the heart from the inferior view. Okay, so now like for example, this kind of the positive electrode which is put on the left arm, we are going to be looking on what we call from the left arm, and then we look on this kind of on what you call on the right arm. So now, for example, if I come and I look on the heart from this corner like this, and now this kind of the lead here, this one he called it as lead 1. He called it as lead 1. Okay, and then also there is another lead whereby you're going to be looking at the heart from the inferior view. Okay, we're going to be looking from what you call from the left leg, and then we look on what you call the right arm. So now we are looking at the heart from this kind of the view. Okay, so now whenever you're looking at the heart from this kind of from the left leg and on to what we call to the right arm, he called this one as lead 2. Okay, he called this one as lead 2. And even also you can also have this kind of the lead whereby we are looking at the heart from the down area, and we are looking on what we call the left arm, and he called this one as lead We called this one as lead 3. Now, over the sudden, he came up with what we call Einthoven's law. And now, how does Einthoven's law say? He came up with what we call Einthoven's law. He said that when you add up lead 1 and lead 3, you will come up with lead 2. Okay? Meaning that if you add lead 1 plus lead 3, you're going to be getting lead 2. That's what we call the Einthoven's law. Then we also have some other kind of the leads which are going to be also helping us in looking at the heart from different angles. We have this lead here which is going to be looking at the heart from the left arm, and this one here is just called AVL. Okay. We also have another kind of the view which is going to be looking at the heart from the right arm, and this one is what we call the AVR. And even also we also have another kind of the lead which is going to be looking down on what we call on the left foot. Okay. So now this one here is what we call AVF, is looking from the heart directly from what we call from the left foot. Okay. So now when you look at this, we have now also created more kind of the 6 leads. What are these 6 leads? We have these ones which are called augmented leads. Okay, we have these ones which are called augmented leads. And when we talk of augmented leads, we are going to be having AVR, we're going to be having AVL, and also going to be having what we call AVF. Okay, and these kind of the leads, they are going to be unipolar. Okay, they are going to be what we call unipolar. And then also, these kind of the leads, lead 1, lead 2, and lead 3, these ones are going to be what we call the bipolar leads. Okay, so now we have also another category of the leads, which we are calling, this was category number 1, this is category number 2, then also have category number 3, which we call the bipolar leads. And when we talk of the bipolar leads, we're going to be having lead 1, we are going to be having lead 2, and we're going to be having lead 3. So if you have D3 leads plus D3 leads plus D6 leads, you're going to be coming up with 12 leads, which is going to be a normal 12 lead ECG machine. Okay. Now, we have said that we are looking at the heart from different angles, and we have said that all these leads are going to be giving us a clear picture on the ECG machine. And now the question is, out of these 12 leads, which one of these leads is going to be giving us a clear wave pattern on the ECG machine that is going to be much of reference in this interpretation of what we call the ECG? When you look on these kind of the leads, they're all going to be giving us different kind of the views on our ECG machine. But the best kind of the lead that gives the clear wave pattern on the ECG for a normal human being is going to be the lead 2. Now look at this. This is going to be our lead 2. We are looking from the left leg, and then we are looking to the what we call to the right arm. Now, when you look on the structure of the heart, it is always trying to bend towards facing what we call the right side. Now, it means that I'm going to be looking at the heart from this area like this up to what we call to the right arm. So now this kind of the lead is what we call the lead 2, and it's going to be giving us a clear wave format because you are looking at the heart from the inferior view. Okay, so now we are going to be using lead 2, which gives a clear waveform pattern of the ECG machine. Okay, and how is it going to be arranged? We have what we call a negative electrode, which is put on the right arm, and then also have what we call a positive electrode, which is put on what we call the left arm. And that kind of the axis gives us what we call the lead 2, which gives us the best clear wave pattern on the ECG machine. Okay. Now that we have had the clear orientation of what we call the leads, we are going to first have a very brief break. Then immediately after the break, we are going to be using this lead 2 and see how we are going to be how it's going to be helping us to generate our wave pattern, because this kind of the lead is going to be giving us a very good kind of the picture of the P wave. It will give us a very good picture of what we call the QRS wave complex, and also it will give us a very good picture of what we call the T wave. We are going to be putting our negative electrode on the right arm, and then also shall put a positive electrode on the left leg. And then we are going to be seeing how the electrical activities of the heart are going to be helping us in generating that wave pattern on what we call on the ECG paper. Okay, we meet immediately after the break.